Okay, good morning, everyone. Again, I do apologize for the error in the Zoom, but we did have a double booking, so therefore I had to send out another Zoom link. Thank you all for participating. We'll go ahead and get started. I'm not sure, and I don't see if we have our director, Tanya Williams, available, but I just wanted to acknowledge her presence if she was available, but I don't think she's made it on yet. So we'll continue forward and kind of get through this meeting. Yay, Thursday. You can see what kind of week I've been having. So I hope your week has been better as well. So I do want to let you all know that we do have another assistant director over the placement and residential licensing unit. So she's over the licensing unit in general for DCCECE. Her name is Dawn Jeffrey. She's currently in another meeting at this time, but she may join if she gets a chance. But I just wanted you all to be aware that we do have another assistant director. Our former assistant director, Ashlyn Abney, has taken a job in Texas. So we do appreciate Miss Dunn. And so if she comes on, we'll welcome her at that time. So I do want to just kind of ask you all if anything positive, or have you had any recent successes either at your placement agencies or at your residential facilities? Is there anything that anyone would like to share that maybe be positive or a success at your facility? And I'll go on mute and just let anyone just shout out. Shout out their provider or facility. Okay, it looks like maybe we're not having such a good time. I'm not real sure. But if you ever want to, okay, we have something in our chat box. This is from Miss Renissa Adams, and she's at Piney Ridge Treatment Center in Fayetteville. And she says, I want to thank PRU for their continued guidance and assistance. You're very welcome, Renissa. And if you all don't mind, could you turn your cameras on? I would love to see who I'm talking to, um, especially my team. We have a lot of new faces, and so I just want everyone to kind of get familiar with everyone. Um, and so Renessa, very much welcome. I can see the growth that Piney Ridge has had since we've really gotten time to focus more into the facilities. There's been much growth. That's what we're looking for, because we both have the same goals of ensuring that the children at these facilities are getting their needs met, and they're in the appropriate environment. Because a lot of the youth that come into Arkansas are coming from many, many miles away, some from Alaska, Virginia, Maryland, Hawaii. So we want to do our best as just good people overall to ensure that all of our youth in our placement homes and our residential facilities are getting the best that they can. So thank you very much. Does anybody else have anything positive going on at their facilities? Okay. So
Um, I'm sorry. This is James Ball at the Fort Smith Boys Home. I don't know if I have really anything positive. I just wanted to share, what we've been dealing with here. We've gone a year and a half without a problem, but we had our first COVID outbreak about 2 weeks ago. We've had 2 boys test positive. We've had 5 staff out with it. It's just been it's been a hard time. I will say the boys have done well with it, being quarantined to their rooms, having to follow all the rules. They're doing a lot better than I thought they would. Hopefully we'll be through it and they'll be back in school next week.
Sure. And so, James, I want to let you know that you are not the only facility who's experiencing an outbreak. So we are seeing that more often, especially with this new Delta variant. They say it's easier spread. And so we are seeing more positives across the board with our residential facilities. And if there's anybody from a residential facility that may have experienced that in the past, is there any advice that you can give James at the Boys Ranch?
James, this is Ellie with the Northwest Arkansas Children's Shelter. We've actually had two COVID outbreaks, one in February and one just a couple weeks ago. I don't really have a lot of advice as far as how to handle it. We did the best we could and it was great, and I'm sure y'all are doing the same thing. But what I would share that I guess was a silver lining to this last situation for us was we had been talking to all of our kids who were eligible for the vaccine about getting it. None of them were interested, obviously, because kids don't want to get shots. But after our most recent outbreak, every single one of our eligible teens came and said, "Get me that vaccine right now." So there is some hope there, and I'm sure that's hopeful for maybe longer term facilities that when these outbreaks are happening, these kids are getting vaccinated, so their next placement is hopefully less at risk of having an outbreak there.
I will say, I think next week after we get through this, we're definitely going to be re-asking all of our boys. I've only had a few that have wanted it and got it. Unfortunately, they didn't get to get their second round. This hit right before they really get their second shot.
Okay, so they had their initial shot and then caught COVID. Is that correct?
A couple of them did, and then they've been quarantined. So the boys that wanted it have not been able to get their second shot. And I think some other boys are probably going to want it after this.
Oh, okay. Yeah.
Because we had one boy that got it. We started our 10 days. Sorry. And then we had a second boy that got it, and we had to start the 10 days over.
Mm-hmm.
So the boys are definitely getting frustrated. And I think that's going to change some of their minds.
So my advice would be, especially if you have staff that come and go, just kind of speak to them about being mindful when they're out in the public. Like, hey, it may be beneficial if you wear a mask, or make sure you're washing your hands appropriately. Again, you can't make anybody wear the mask, but just kind of like maybe encourage that, because we do know even if you do have youth that leave your facility and go
Yes,
to
man. We've encouraged
school.
masking, of course.
Yeah. But sometimes those kids get to school and just, if no one's looking, they have that mask down under their chin. So just kind of talk to them about the importance of being safe. I'll say that, being precautious. Thank you for that. So that was I was going to lead into what are the challenges or barriers to you all effectively operating your homes or facilities. So we just talked about COVID. Is there anything else that you all are having any challenges with, or are there any barriers that you are experiencing at your facilities or at homes? Is there something we need to know about as our agency, the licensing unit? Is there something that maybe we could assist you with, or maybe we could, consider and try a different option? Or I'm just trying to get some feedback from you all. Okay, if there's nothing, I'm going to think the licensing unit is A1. We're doing a fantastic job when we're going to your facility. So good job, licensing unit. I appreciate the hard work that you're doing. Okay, so if you all do not mind speaking on COVID, if you could please let your licensing specialist know when you do have positive youth at your facility, because we do track those. And we just want to be respectful to let our licensing specialists know that, hey, maybe there's an outbreak at this facility. You can kind of slow on your monitoring visits, or be extra precautious when you go there, because they will have to go if there's an emergency situation. But if you could just please let our licensing specialists know when you do have a positive at your home or facility. So we would appreciate that. So we do have some members from the regulatory check unit that are available on this call. And so we do have their, I want to say, Assistant Director Pamela Burton. Did I get that right? Pam? Okay. She's available with her team, Kayla Bodie. Kayla Bodie is the program manager. So have there been any issues that you have not been able to get an answer from concerning the regulatory check unit or background check unit that maybe we could write down and get you an answer back, or you may be able to get an answer on this call? Are any of you experiencing any troubles with that area? And I see that Kayla Bodie, their whole team just entered their information into the chat box. So if you don't want to ask your question here, it's totally fine. Just see their information in the chat box, and you can send them an email or give them a call, and they can try to assist you with any issues that you're having with the regulatory checks or background checks. A lot of people are not used to regulatory check. That's why I keep saying both of those. Okay. So moving forward, I do want to let you all know to just be aware that the licensing unit, we can and they will complete unannounced visits. I know sometimes what we've seen a few times is that, maybe the agency or whatever provider, they were not expecting them. And, sometimes there's a little bit of, pushback from that, but our licensing unit definitely can make unannounced visits to any licensed agencies. So just please be mindful of that. If you're running into an issue where it's happening too often and it's interfering with how you conduct your work, just please let me know and I can speak to their licensing staff. Okay.
Ebony.
Yes, ma'am.
Hi, this is Renessa. I know that, we had some issues where staff didn't understand, even though we had done education. So we have an attestation form that every new employee signs and yearly. And I also go over it in new hire orientation. And I've also instructed them all that, if somebody shows up, give me a call. And because sometimes they're concerned about HIPAA and they don't understand, even though they've been educated. So that's something I think that's helped us, is putting the attestation in place.
Thank you for that, Renessa. I do appreciate that. Okay, so moving forward, does anybody have any questions they'd like to ask at this time? Okay, give me just a second. Oh, and just to go back a little bit, so Kayla Bodie, she has just been promoted up to our new program manager for the regulatory check unit. So it's on my screen, she's at the very top at the left. Kayla, if you could wave or just introduce yourself and say hello. They probably already spoken to you before, but just, hey, go for it.
Hi, everyone. So yes, I have officially been promoted to program manager, and I have been with the department since March. And previous to that, I was a director of facility for the last 8 years in the child care side of the world. And so I understand a lot of your frustrations, a lot of the things that you are dealing with on a day-to-day basis running a facility. So I come to you with an understanding. I'm really excited for this new position. And yeah, if you need anything, my information is in the chat box. Please feel free to contact me. and I will make sure that our team assists you. We are here to help, and we want to do everything that we can to help providers that are doing what you guys are doing for children in the state of Arkansas. So if you have any questions, please feel free to reach out anytime.
Thank you very much, Miss Kayla. I do appreciate that. Okay, so just moving forward, I did want to ask you all, how is your medication pass going? Because we are seeing some trends with a lot of citations concerning medication, either that it's not being properly logged or it's not being logged at all. So is there anything that is working for any of you concerning your medication pass that maybe you can kind of discuss? So that we can maybe help out some others who may be having some issues with how medication pass or pill pass is going at your homes or facilities. Anybody? You all are so quiet this morning. Okay, well, just to let you know that please take your time when you are conducting pill pass or medication pass. I'm not sure what you all call it. If your nurse is the one who's passing out the medication, my suggestion would be to just ensure that she's not being bombarded with youth. Maybe have one individual come up at a time instead of having them in a line, and just make sure that they take their time. If there's any trainings or any additional classes that your staff can take concerning medication pass, I would encourage that, because we really want to be careful that we're not giving the youth the wrong medication. So that's very important. So just please keep that in mind. And you know what? I'm gonna turn this meeting over to Rebecca Mitchell. I think she has she's going to introduce someone for us. Rebecca, are you there? Let me see if I see her. Okay, she may not be there. Okay, I think we have, is it Mr. Jeff Williams?
Yes.
Okay.
I'll introduce myself.
Thank you. Go ahead. Go ahead.
Okay. Thank you for everybody on the call. I know that some of you may already have had the opportunities for interaction with me, but just in case everybody, for those who have not, my name is Jeff Williams. I'm the, I handle a lot of different things for DHS, but the primary reason for this call is the fact that I head up the effort for getting our Medicaid population vaccinated with the COVID vaccine. I've been reaching out to multiple different groups over the last couple of weeks, working, in an effort for this. And many of your clients that you have are Medicaid clients. They have different services, different levels, and different organizations have different levels of contact. But we wanted to make sure that you understood the program that we have and a role that you can play in it. For all of our programs and services that reach out and touch Medicaid patients that we have out there, we are trying our best to provide you the information you need that you can pass on to those clients. The reason for that is that the Medicaid population has a substantially reduced number of individuals who are being vaccinated. When we look at the general population versus the Medicaid population is a full 2 digits behind, and it depends on which numbers you look at as to where they're at. But they're substantially behind. One of the primary reasons that we found this to be the case in looking at all of our data is that they're simply not receiving the information they need from a trusted source, from somebody that they've already got a relationship with, somebody that they feel confident in listening to, and that's where you can really play a role. Many of you are providing services, and sometimes long-time services, to this clientele, to the families, to the children of these families, and they trust you. They trust you a lot more than if I got on a call with them. They'd say they wouldn't have a clue who I was. They wouldn't know whether they could believe me or not. But you have a different type of relationship. So we want to be able to leverage that relationship you have for you to be able to provide the information that those families need to make an informed decision on becoming vaccinated. There are multiple reasons why people are choosing not to be vaccinated. And we're not out there, trying to strong arm people. We're just trying to give them the information they need to make sure that they are making an informed decision for themselves and for their children. Even if they have children in your program that aren't currently eligible, which means those are 11 or younger, other people in those households, the parents, grandparents, friends, neighbors, things like that, other children are eligible, and we want to make sure that you are doing the best you can to provide them that information. So we're asking basically for your partnership in this program. We are just trying to give them the opportunity that the rest of the population across the state of Arkansas has. When you start talking about the Medicaid population, you start talking about people who have obstacles to issues, for instance, you may have somebody that has had a transportation issue. We've got ways of getting over that. We'll go out and pick them up and take them to the vaccination appointment. And then you might have people in their households that for one reason or another can't leave the household or don't desire to leave the household. They may be more of that homebound population. We've got people that will go to their homes and provide them the vaccination. These are all, we've got programs out there that will help them with pretty much any obstacle that they might have. And we just want to remove any barrier that might exist for this population that prevents them from getting vaccinated or doesn't provide the information they need to make a well-informed decision on doing that. So DHS has created, and it's we have a little website where we have all of the toolkits on it for those who are looking for it. It is ar.gov/MVP, like Mike Victor Papa. It stands for Medicaid Vaccination Program. And if you look on there, there's going to be a toolkit that's available there for the providers and for the clients out there. And all it really is it's everything. Our communications team has created everything that you would need. It's stuff that you can put on your social media pages. It is, things that you can email to clients. You can print these off and put them in your facilities, on the walls in some of your facilities. You can just share this information with the clients. And as I said, we've tried to think of every possible way you can contact them, and whatever method you may use to communicate with them, whether it's email service, an email service, a text messaging service, just as I said, something that you can put up on your wall. We want you to take advantage of every opportunity to make contact with these clients, because the reality for us is, and trust me, I know how hard it was for DCC, ECE, and the facilities that they partner with in providing early childhood education. COVID this last year and a half now has been exceptionally impactful for many of your programs. Many of your programs have been shut down or to limit services that were available. So you understand how these things can be impactful. Well, the more people we get vaccine, the less impact it's going to have on your operation and services that you provide out there. So we just want to be a partner with you. Like I said, you're a trusted source to these folks. Take advantage, download some of those graphics, put them up in your facilities, email them to your clients. If you text message, you can attach it to a text message and send it out. Whatever method you may have to communicate with your clients, we want to be a partner in there for you. If they express a concern or issue with getting transportation, we can take care of that. If they can't leave the home, we can take care of that. We're going to make an effort across. We are going to make an effort across by whatever means we can in doing that. So. And I know that I know that the different services that different folks provide, and I know that with y'all, you basically, what we're talking about here more is child care providers, is child care or foster. I guess it's foster care in this instance, placement. But we all play a role in this, in the service that we provide. So regardless of the service that you may provide, the folks that you reach out to, if they are Medicaid clients, we want to support your effort to support that client in doing that. And those services are all available, as I said, on ar.gov/MVP. And I want you just to think about the different clients you come in contact with. When it comes to foster care, in this instance, foster care placement, we know full well that there are a lot of your clients that are Medicaid eligible. If you have questions about their eligibility, I want to make sure you understand it. We want to reach out to everybody with these services, whether they are Medicaid clientele or not. But we know amongst the population that you serve that there are Medicaid clients within that population. So make sure you're just communicating with them. Make sure you understand that we're a partner with you in this effort. If you run into a problem, communicate it with us. If you say, hey, I've got somebody over here who wants to get this, wants to get the vaccine, but here's the problem. Trust me, I'll solve that problem. I will find a way. If I have to personally drive to Lake Village and pick them up to take them to a pharmacist, I'm not above that. I will do whatever I can to help the clients that you serve get their vaccine. We'll make sure we're taking care of them. But as I said, the role that you play in here is really, you're just a trusted source, somebody that they know, somebody that they've done business with, whether it's foster families, foster children, whether it's some other type of service. The services you provide are essential, and you are a trusted source for those individuals. And we want to use that relationship to make sure that they are receiving all of the services that we can possibly provide. So I'll open up for any questions anybody might have. And if not, then I'll just look forward to the partnership that we can have over the next couple of months, trying to assist this population with getting their vaccine.
So, Mr. Williams, is it possible to get same day vaccinations? Like, are those appointments hard to come by?
No, in the vast majority of the cases, there are a couple of areas in the state where and it's not really the issue with appointments. It's the distance sometimes you have to do to get to an appointment. More rural areas, there's less opportunity and a little bit further service. But I know that I referred somebody on. I think it was Monday, they called me up and they were wanting to get vaccinated. I directed them in this particular instance to one of Baptist Health's clinics, and they were able to walk in, and there's many clinics. If you go on to the Department of Health website, that's healthy.arkansas.gov, and click on the COVID-19 information, there's a map that's right there that you can zoom in, zoom out of, or you can just click in and put the information, and it will provide you clinics, pharmacies, et cetera, in your area that are providing the vaccine. And it'll say whether it requires an appointment for you to do so, or if you can just do it via walk-in. The walk-in clinics will cover about 90% of the population in Arkansas. Like I said, there are a couple of areas where it's a little bit more difficult to do so. But healthy.arkansas.gov will give you all the information that you need on clinics in your area with the vaccine. And you can say, I want a Moderna, I want a Pfizer, I want a J&J. I'd like to be able to do a walk-in versus, some people it works better by appointment. Whatever metrics you need, that information will be there available to you. And we can get you vaccinated almost always the same day that you ask for it.
So speaking for, just a question for some of our larger facilities, if they're like having trouble getting like more masks or those type of supplies for their staff, could their website ar.gov MVP is there a way for them to reach out to someone that maybe could assist with getting more masks for their staff, or I don't know, gowns or gloves, or?
That is a little bit more difficult in getting, get it like that. This is what I'll tell you, that website won't help with that. That's going to help you with information on things like that. If you've got an issue with obtaining masks or gloves or things like that, just email me, jeff.williams@dhs.arkansas.gov, and I will do the best I can to help assist you with finding supplies of PPE. I've got someone on my staff, that's all she does is work trying to find PPE. I will assist you with that. Now, that is no guarantee we're going to be able to find any. It's different times of the year and during different supply chain issues. It can be difficult. What I always tell all the folks that have worked with us over the last year and a half in doing this, if you've got an opportunity to order PPE, if you have a supplier who has it available, order as much as you can and get it. Think, what am I going to need in the next year in PPE? And if you can get it available to you and you can afford to get it, and trust me, I understand the afford part. There's a budget we got to consider in doing this, but get as much as you possibly can. I'm going to give you a great example. Right now, there's difficulty in getting the rapid test, the Abbott rapid test cards, which so many facilities use across the state. It became available to us about 3 or 4 weeks ago. The supply chain opened up just a little bit. I ordered 6 months worth for our facility. I'm talking many tens of thousands and thousands of tests that we ordered, and we got them in. And we literally were we were on the last shipment before they started canceling orders on it. I'm very thankful we did it, but it's because we were being proactive and constantly searching one, and then when available, ordering the max amount we possibly can, that we can do that. But it takes constant, diligent effort to locate these suppliers and doing that. But I will assist you in whatever way I possibly can in providing that. I can't provide it out of my supplies simply because it's a state procurement, and auditors go crazy on that stuff. But I can try to turn you on to a particular client or a particular supplier that might be able to provide the supplies you need.
All righty. Well, thank you so much, Mr. Williams. I do appreciate you for just taking your time and just giving us some very much needed, very good information. And if no one else has any questions, then I thank you so much, sir.
Okay, thank you all. Have a good. Like I said, if any questions come up, you got my email now. I'm weird. People email me at 2 o'clock in the morning and they're shocked when they get an answer a few minutes later. Now I don't ask you to email me at 2 o'clock in the morning, but hey, if that's the time you're available, I'll answer your questions. So thank you very much. Appreciate it. Email me with any questions or concerns. I'm happy to help out however I can. Thanks.
All right. Thank you so much. All right, providers, I have 2 more things and then we will be ending this provider call. So as you all know, that Act 772 was passed and it became effective July 28th. So for any facilities or agencies that have an inactive license for a year, then those licenses shall be terminated. And so just wanted to make you all aware of that. There are a few that we're looking at. So I may be sending you some correspondence, but that was the law that was passed. If you want to speak more to me about that, you can just feel free to shoot me an email. And then final thing, our next Child Welfare Agency Review Board meeting is scheduled for October the 27th of 2021 at 1:30 p.m. here in Little Rock in conference rooms A and B. So any board action requests that you may have, the deadline for those will be on October the 3rd. All righty. So if no one else has any other questions, or if no one else has anything to say, then I hope you all have a wonderful holiday. Enjoy it. Be safe. Wash your hands. Wear a mask if you want, but social distance. Thank you so much and have a great weekend.